Hi guys, it's Victoria, and this is my 19-week pregnancy update, doctor visit update, ultrasound update, and possibly nursery update too. I did a little video last week of sort of a little bit of progress we made on the nursery, and if this video is not super long, I will add that at the end, and if it does end up getting to be a little bit long, I will do that in a separate video. We've made a little bit of progress on the nursery, so I wanted to share that. So I am 19 weeks and 2 or 3 days pregnant. I think I mentioned this before. The apps that I have and my calculations put me at 19 weeks, 2 days, but the doctor and the ultrasound both come up at 19 weeks, 3 days. So I don't know where the discrepancy is coming from. It doesn't really matter, but so 19 plus. Things are really good. Just in the last week and a half or so, I've started feeling tons of movement. Like not frequently, but when I do feel it, it's like full on kicks. You can see them from the outside. Matthew felt them the other day, especially at night when I lay down and relax and just put my hands there. It's just like boom, boom, boom. So that's awesome. I love it so much. Also feeling some kicks like straight down, if you know what I mean. And I had a lot of that with Alexandria. My ultrasound today did confirm that right now she's feet down. So it makes sense that I would be getting kicks in that direction. I've been feeling, I don't want to say dizzy because I'm not really getting that dizziness when I stand up, but just really out of breath, really winded. Like when I walk up the stairs, it's just like, I just like can't catch my breath. So that's, I've sort of had that all along, but that seems to be getting a little bit worse. My boobs seem to be bigger. I'm large chested to begin with, and I never really noticed too much with my other 2 pregnancies of a size change, especially during pregnancy. But this time it's like every few weeks I'm like, oh, my boobs hurt, and then they like get bigger, and so that's kind of a pain. Luckily I still have a couple bras that do fit pretty well, but it's just, I don't know, it's hard to contain them in shorts now. So that's about it as far as my update, as far as things that have been going on this week. It's a crazy, crazy busy time. My sister's wedding is on Saturday, so things have been really busy with that. She doesn't live here, so my mom and I are doing a lot of the last minute things, trying to get ready, and she comes into town on Friday. So I haven't honestly been thinking a ton about being pregnant. It's like you just kind of forget sometimes. And this is probably our last. I don't want to say for sure, but probably our last. So I'm really trying to treasure it all and take it all in and really, just be grateful for being pregnant and enjoy every second of it and not get too wrapped up in the everyday things so that I forget. So just trying to do that. And I will, this is sort of a deep thought, I guess, make a comment. I'm a pretty positive, optimistic person for the most part to begin with, especially when it comes to, social media and whatnot. Like I'm not one to go on Facebook and complain about things very often. Sometimes if something really gets to me. And I've just been finding lately, it just seems like people don't realize how lucky they are. And it's just really bothering me more now than it normally does. I guess normally I can just brush it off or I hide those people from my newsfeed. But lately, especially in one, like I'm in a couple of Facebook baby groups, and in one in particular, these aren't YouTube related baby groups. These are just baby groups that I found when I was pregnant with Alexandria and this pregnancy as well. And we had a really sad thing happen in my baby group from Alexandria last week. One of the moms passed away. And I don't want to be a downer, but she'd been sick for a while and it wasn't a surprise. But to me, it just brings everything home. And then I turn around and 2 hours after we hear this news, people are complaining about, oh, I'm so tired about being pregnant. I hate being pregnant. I don't want to be pregnant. Or my child won't stop crying. And you know what? Like, I just don't know how you can't take an event like something like that and have it put your life into perspective and how even the things that seem big aren't. Like how lucky we really are. So I'm just trying to stay positive and surround myself with positive people and remember how lucky we are. Of course, not everything is sunshine and rainbows and unicorns all the time, every day. Of course not. It's not like that for anybody, but I just try not to let myself get wrapped up and caught up in those emotions and try not to let other people that seem to get down over the little things bother me too much. So I think we're going to have a visitor. Anyway, so on that note, I had my doctor's appointment this morning and I had an ultrasound this afternoon. Come in. Come in. Hi. Oh, hi. You put a hat on. Who's that? Who's that?
The baby.
The baby. So my appointment this morning went really well. It was really quick. They got me in and out. The waiting room was packed, but there was 4 doctors on today, so I got in pretty quickly. My blood pressure was good. I think it was like 110/70. My weight was good. I was up just over 3 pounds from my last appointment, and I think about 11 pounds total, so that's pretty good. I've been eating better than I was at the beginning, so that's probably helping slow down the weight gain a little bit. Heartbeat, she found the heartbeat was great. She did measure the fundal height. I didn't get either of those numbers. We got to talking and I just forgot to ask. Everything else, I guess, looked good. I will say that I was a little bit, I don't know, disappointed. I won't say upset because it didn't really upset me, but my doctor, she was a little bit negative today, and this is the doctor that I've seen the most through all of my pregnancies. She delivered Noah. I saw her a lot for Alexandria. This is my second appointment with her this pregnancy, and I love her. She's wonderful. She's really like upbeat and perky and friendly, and I feel like really comfortable with her. I feel like she's a friend. And I guess today I just felt like she was like, well, the baby will probably be breech, so you'll probably have a C-section, and she's probably going to come early. And I mean, yes, those things are probably true, but I just felt like we don't need to go on those assumptions. You know, she might not be breech, and she might not come early or like super early. And, you know, she said most C-sections are scheduled for 39 weeks, but yours will most likely be emergency. And I was like, don't use the word emergency. It's maybe say unscheduled, because chances are, and I know this is true, like I'm not unrealistic that I think I'm going to go overdue, although you never know. I know I probably will go early, and they don't usually schedule C-sections to 39 weeks, so I will probably be in the situation where labor starts and I go in for a C-section, which is fine, and I'm totally fine with a C-section. I just don't want to make any decisions too early, and I don't want to go on the assumption that it will have to be a C-section. But I just brushed it off. I didn't really, you know, it's good to be prepared, and I didn't let it get to me. We'll worry about that when we get further along. So that was my OB appointment. And then this afternoon we had our anatomy scan, and everything went great. She is still a girl. Everything measured perfect. She's like 50th percentile. She looked great. She was moving around a ton. She is breech right now, and if it follows like my other 2 pregnancies, the position that they were in at this point was the position they stayed in. They didn't flip at all. Noah was head down super early. Alexandria was head up super early, and they stayed that way. So I'm still, of course, like I said, optimistic that she might flip around. I mean, you never know. But I do know that there is a good chance that I will have a C-section. And like I said, that's fine. The cervix looked great. She said it's kind of hard to measure, but it was probably about like 4.5 centimeters, I think she said, which is longer than it was at the last appointment. But either way, it looked really good. So that's really exciting. That's the main thing is, you know, baby's great. So now my body needs to do what it needs to do to keep baby inside as long as possible. So everything was great with that. She wants to see me in another month, and my OB wants to see me in another month. And then the OB said that they'll probably start seeing me every 2 weeks after that. So I'll be 24 weeks, and then we'll go to every 2 weeks probably. And I'm not sure about ultrasounds, if she'll want to see me more frequently or if we'll stick with once a month. I'm not sure what she'll want to do. From from there on. So that's the update, and I will insert a picture from the ultrasound. It's not the greatest picture. I can't quite make out exactly what's going on, but I know the baby is facing up and had her nose like buried in the placenta in the picture, and you could see her like little mouth going, and it was that's just so neat to see. And I'll see how long we're at. I'm not sure because I stopped the video, but if it's not too long, I'll insert the little nursery clip at the end and I'll do a belly shot. And I will talk to you guys in my next video when I will be 20 weeks, which is halfway, but probably further than halfway for me. So really exciting. So if you guys have any questions or comments, leave them below. And I will talk to you in my next video. Bye. So here's my 19-week belly. This shirt, I like this shirt because it makes the belly look big. And from the front. And from the other side. 19 weeks. My belly button is getting a little bit shallower, but I've never actually had it pop out either time. So there we go, 19 weeks.